they're doing fine. I thought that everyone else was going to respond. At least there was a good chance that everyone else was going to respond and prevent the outbreak from coming here. And part of that was because our original warning in January actually got the attention of the executive branch, or the White House, and they limited travel from China. It looked like a good start. But it didn't happen. And as the countries of the West, including Europe and the US, didn't respond, about 6 weeks ago, I realized that we were in huge trouble. And I sent out a call for volunteers, and within days they put together the endcoronavirus.org website. And there are something like 6,000 volunteers, of which close to 5,000 are on Slack, and working on all kinds of things about the outbreak. So I'll talk about that a little bit more later. Let me focus on the outbreak. And again, the challenge in any complex system is, first of all, identifying what's the most important thing to understand. And in this case, there are really three things to understand. The first is that it's a horrendous disease. And the horrendous disease is subtle, right? It's deceptive, because you have 80% of cases that are mild and then 20% of cases that are severe. And of the total cases, about 6%, so the 20% divide into 14% and 6%, the 6% are on ventilators. People can't breathe. And of course, the 20% also can't breathe. It's a terrible disease. And if you think about what that means in terms of a population, it's huge. And then, people have all of these arguments about the exact death rate, but the death rate is about 2 to 4%. And that's also tremendous. It's, over an order of magnitude larger than flu. And even flu is a terrible killer. But this is a horrendous killer. So the first message is, this is a terrible disease. We don't want it. And that's really all we need to know about the disease in terms of its severity. The second thing that we need to know is that it's fast. It's faster than Ebola. It's super fast. In a week, it multiplies by a factor of 10 unless you have strong interventions. So every time you look at what's going on, you're looking at the tip of the iceberg, and a week later, you're still looking at the tip of the iceberg. That's 10 times larger. And people argue about exactly the number, and now they're getting the better number. Is that, at the early part of the outbreak, you're not seeing all of the transmission, which is what they fit the original China. But it was obvious that it was rapidly propagating, because otherwise we wouldn't have the catastrophes that we're having in terms of cases aggressively multiplying. And there are problems with the math, problems with the fact that of normal distributions and how they're being modeled by epidemiologists. All of the math details about how to do this right, they're important. But the only thing that you really need to know about the outbreak is that it's fast. The exponential growth is such that it looks like it's nothing, and then very quickly it's overwhelming. And of course, as people in this community know, an exponential is unforgiving. So once you get more than you can handle, you can't ramp up exponentially. And the disease is. So that's the second thing that you need to know. The third thing that you know is that we can stop it. And we know we can stop it because we understand its transmission. People keep trying to create all kinds of incredible, demons that are going to strike us, like, a super amount of non-symptomatic, never symptomatic cases that are transmitting. And so we can never, gain control of this disease. All of that's not true. The disease can be stopped. We saw it stopped both in China and in South Korea. We know what it looks like to stop it. We are seeing now similar effects in other countries, including Italy, including Washington State in the United States. The number of cases is going down, and if it's going down dramatically, exponentially, which is what happens, right? The fact that it's exponentially growing is because it's a multiplicative process. As soon as you get the multiplicative process to have a factor that's less than 1, it's going to go away exponentially. So you can get rid of it. And that's really what we have to understand. All of the rest of the details of the epidemiology and of the mathematical representation of modeling is not important. It may be helpful to know some of the details, but it's not important in terms of knowing what is going on. So the crux of the statement is modeling is actually not super helpful. It is helpful, but it's not super helpful. The most helpful thing is to realize that it's about action. This is an action-oriented challenge where if we act quickly, we can stop it, but we have to actually go all out. Half-baked, whatever terminology you want to use, measures just don't do it. Not only they don't do it, they sometimes give us the false belief that we're doing something because we're, quote, flattening the curve. But flattening the curve is not a solution to this disease, because it will last forever, effectively, if we flatten the curve. But if we crush the curve, right, we can stop it. And we actually only need 5 weeks about to stop it. And so if we take it seriously and we do everything that we need to, we can get rid of the disease in about 5 weeks. And that's what China did. That's what South Korea did. Why don't we do it too? So let's talk about the 5 weeks. The 5 weeks happens basically because of the incubation period. So an incubation period, the typical incubation numbers is about 3 to 5 days. The maximal incubation period, there's a long tail, but basically you need 2 weeks. That's the number that people use. It's not a bad number to think about. So if we take 2 weeks, and if we prevent transmission during those 2 weeks, by and large, then by the end of 2 weeks, we know everybody that is sick by symptoms. We'll talk about details later, but we know everything about people by symptoms. The problem with 2 weeks, so if we knew at 2 weeks, we could just isolate everyone that has symptoms and everyone else could go on about their lives. But of course, it's not perfect. So we have to, the people that are most infected in the first 2 weeks are people who are living with other people that are infected. There's also, of course, some leakage if people go to get necessities. So you can't break it in one incubation period, you need another one. Basically, you need 2 incubation periods. By the second incubation period, if you do things well, it's going down, boom, like, this exponential decline, and then you need another week in order to make sure that you're okay. That's the 5 weeks. It's very straightforward. If you're in the core of an outbreak in Wuhan, and I'm sure in New York, right, you'd need an extra week maybe to check, so maybe 6 weeks. So in 4 to 5 weeks, in most places where the outbreak is not bad, and 5 to 6 weeks where the outbreak is really bad. And then, if you need to be careful about all kinds of things, maybe open up gradually, which is very good, and we'll talk about it. So that's the disease, that's the plan, if you want to stop it. And we need to stop it. And again, in order to be clear about this thing, it turns out that the most relevant parameter is the size of a local outbreak. And if you keep that in mind, it clarifies things. So the size of a local outbreak is the number of people that get affected in a community in the dynamics of the outbreak. In order for a community to be a community, it has to be separated from other places so that it's not transmitting. We'll talk about that too. But the size of a local outbreak turns out to be the key variable. And if people understood that, they wouldn't be debating about the difference between the humanitarian cost, the human cost, and the economic cost. Because both have to do with the size of the outbreak. And that's it. So if we stop the outbreak, we tremendously reduce the human cost, the lives lost, the suffering, and we also reduce the economic cost because it's gone. And then we can go on about our regular lives. So again, keeping in mind what's important really focuses attention on the right things. Okay, so now let's talk about the details. How do we stop it? And a lot of the focus has been on the lockdown. And there's a structural confusion about what the lockdown is about. And if you go, there's a Science magazine interview of the head of the Chinese response, who makes this point very clearly. And I will say it from my perspective also, but he says the lockdown is cordon sanitaire. Cordon sanitaire, if you look up the French, it means a boundary that doesn't allow the disease out. Now, if you remember, going back to this simple model that we talked about, it's about transportation. If you don't have transportation, you don't have a pandemic. Obvious. So the first tool in combating a pandemic is stopping it from getting to places that you don't want it. Now, there's a piece here that I just need to talk about. The WHO and CDC and much of the epidemiological community has been focused on the statement that travel restrictions don't work. So I want to explain to you why they say it doesn't work, and then I'll explain to you a little bit about the politics, maybe. And we'll understand a little bit of the behind-the-scenes action here. So let's say you take an epidemiological model where you have an exponential outbreak in one place, and you impose travel restrictions, okay? So now you say, okay, I don't want it to get somewhere else, we're gonna put travel restrictions. Now, obviously, if you make the travel restrictions eliminate any travelers, then you don't have an outbreak elsewhere, and that would be a very boring statement to make. So instead, let's assume that you cannot stop it altogether. You end up with 1% of people leaking out. So what happens then? Well, if you have a 10-fold increase per week, after 2 weeks, you have a 100-fold increase inside the local outbreak. And by then, the leakage out is the same as you would have had 2 weeks previously. So you've gained 2 weeks. That doesn't sound like a big deal, so why should we do it? That's the argument. What's wrong with the argument? Well, what's wrong with the argument is, first of all, that you've made an assumption about how closed you can make borders. But that's not the most important mistake. The most important error is that you've assumed that you're not going to do anything about what's going on in the community. If you let it multiply by a factor of 100, you're clearly not doing your job. So if you isolate, so remember, complex systems are about dependencies. If you isolate one intervention, travel restrictions, and you ask, will travel restrictions, prevent an outbreak? And the answer is, according to this analysis, no. And they're right. But the point is that it's not the only thing you're going to do. So it's the most powerful thing, but by itself, it's not enough. Okay, so that's really important to understand. So we have to talk about how parts of the response effort work together. But because it's so powerful, it has to be part of what we're... And in China, because they imposed it on Wuhan, they didn't have to deal with the same level outbreak around the country of China. And for a while, we were protected in other parts of the world, but then we sat back and said, hey, all right, we're okay, nothing's happening, until it did. So let's now fast forward to what's happening in Massachusetts. So many of you may be from Massachusetts. Massachusetts is now the third most infected state in the United States, after New York and New Jersey. Notice that Massachusetts is not the largest state by population. Surely it wasn't the earliest state that was infected, right? Washington or California have that distinction. California is doing much better than we are. Why? So today, the governor of Massachusetts stood up and said, it's happening. We're getting the big surge. Our hospitals are in trouble. This is it. Now let me ask you, why are we getting the big surge? Is it because there's some enemy out there that is going to get us no matter what we do? And the answer is no. It's because of what we didn't do. What Massachusetts didn't do in order to stop the outbreak. And one has to say it clearly. There were other choices that Massachusetts could have made that would have prevented our situation that we have. And it's not because of the external circumstances, it's because of the choices of what we're doing. And that's true everywhere in the world. It's true in France, it's true in Italy, it's true in the UK, it's true in Germany. It is not prescribed by the disease, it is prescribed by our actions, our choices. So one of the things that was also just given today, or maybe I think it was today, was a list of all of the number of cases in every community in Massachusetts. And one thing that you notice immediately is that it's everywhere. It's pervasive across Massachusetts. How did it get that way? And the answer is because we didn't choose to use travel restrictions. It's hard enough for people to think about travel restrictions between here and China. It's hard for people to think about travel restrictions between here and New York. But to his credit, Governor Baker did impose some travel restrictions. He imposed 14-day quarantines for anyone coming into the state. Whether people are observing or not, I don't know, right? But that's the principle, that's the idea. But if we'd done it within the state, then only the places that had cases initially, or even not the state at all, because we didn't have any cases to begin with, would be here. And then wherever we had those cases, we would first of all have many fewer cases, because they wouldn't be elsewhere. And second of all, we would be able to focus all of our energy and wipe out the outbreak in those locations. But we're not doing it. And we're still not doing it across the country in any kind of systematic way. So travel restrictions is number one. Number two is social distancing. Social distancing, which we're calling the lockdown, is basically preventing transmission in the community. So people are not supposed to go out and party. They're not supposed to be in big gatherings. That's obvious. You don't want super spreader events. But beyond that, you don't want any transmission at all. Because this disease is so severe and you want to stop it as quickly as possible, people should basically stay at home. If they go out to get necessities, we have to do so carefully. And we have to make sure that there's no transmission. So that's what people are calling the lockdown. I'm calling it that way too, because that's the common terminology. But it's really social distancing within the context of the community level effort of what's going on. 1 point, 80% of transmission in China, and almost surely everywhere else in the world where it hasn't been studied and documented, is within family groups. So the core of the outbreak is within people who live in the same place. So it shouldn't be thought about as just trying to prevent transmission between people who live in different places, right? Going to visit your neighbors or meeting with friends. And I still think, by the way, my understanding is that meetings of 10 people are still allowed in Massachusetts, which is, frankly, insane. Okay, so we really need to prevent transmission within the community, and we need to do everything we can to reduce within the family. Now, the third thing that I skipped, let's call it the zero thing. So there are 9 things, but we can call the first one the zero thing. The zero thing is that we really need to have everyone on board. Government has to be on board, and the individuals, the people have to be on board. If the government creates laws and people don't observe them, if the community is not engaged in doing things to help each other, it really is an all hands on deck thing. It's an all out, everybody should be involved, companies, individuals, etc. And that goes for everyone who we're talking to. Everyone should be involved in stopping this, because it's the worse, the less we do, the worse it is. The more we do, the better it is. And at the individual level, what it means is if government is not doing something, we have to take responsibility for it ourselves. So once you understand what it's about, I hope you will talk with your family, your friends, everybody on board, and then I hope you will also be able to help with your skills. The engineering is still needed. We'll get there. So again, everyone on board is the first one. The second one is, we talked about as being travel restrictions. The third one is being the lockdown. The fourth one is isolation. If we want to prevent transmission, we have to identify cases. This was what happened in West Africa with Ebola. You want to have early detection of symptoms. You want to go to where the people are in the community, find people that have symptoms, and isolate them so that they don't transfer the disease to their family, friends, and to their neighbors. Because, you know, the isolation within households is not going to be perfect, and it's going to propagate and propagate and propagate. So how do you do that? And the answer is the next leg of what it is. So isolation, you have to create isolation facilities. So China had these 2 major hospitals, but they also had 14 facilities altogether, including many major isolation facilities that they used stadia for to isolate people that were mild and moderate, provide them with care, give them free food, you know, really help them in the time of the crisis. Now, to be clear, the issue of isolating people in these big facilities were not the whole thing. They had hundreds of isolation facilities in the community. So what we really need to do at the first order is to create places so that people don't go home to their families and make them sick. So one of the things that happened, we were pushing for this early on, is that healthcare workers don't have to go home to their families and infect them once they're infected in the hospital. So the housing for them. But we're still sending people home that are tested positive if they're mild. That's like, I mean, pandemics 101. Why would you send people home that are positive tested in order to infect their families and their communities? How are you ever going to stop this? So we need to create, so there's this new facility in Boston, right, the 1,000-bed convention center facility. I think that there are 500 beds for homeless, 500 beds for cases that are probably being released from hospitals, but they still have contagion. They have to also wait 2 weeks and have negative tests before they can be released. But there should be facilities. China locked down when they had 8,800 cases. And they ended up with 80,000 cases, 100-fold as many. 800 cases. Do you know how many cases we have in Massachusetts? We had today over 2,000 cases in one day. And we still don't have a lockdown and actions the way they did in China. When are we going to stop it? And the way I say it is when we get it right plus 5 weeks. So we have to isolate people in places. We have to make sure that they don't go to their families. At the very least, tell them, you know, you don't want to go home to your family. Here we have a place for you to stay. If you need to make it voluntary, but it shouldn't really be voluntary. We need to protect all of us from this transmission. So that's the isolation piece. Now, isolation piece goes along with testing. Because if someone has a cough and you have to isolate them, you have to isolate an awful lot of people. So with Ebola, we could isolate people with temperature because that was a good enough signature, and we isolated them at home or near home. They were isolated within the community in isolation facilities. But it's really hard to isolate that many people who have coughs. So you need testing, because testing narrows it down by a factor of 20 years. So what do we have for testing? Well, we don't have testing in the United States worth, you know, its purpose, because we're using the tests on people that are, you know, getting into hospitals and are being put on ventilators because we don't have enough tests. So the testing issue is a real problem. How do we solve that? And it turns out there is a solution. It will take some more steps, and we're working on trying to make it happen. It turns out that the best screening test is actually CT scans. They have a low false negative rate. Sorry. The technical details here may be not as important, but CT scans can be used for initial screening. They have a low false negative rate. They can be done before symptoms even arise. And you want that because you're going to do contact tracing. The people who are in a household with someone who has symptoms or test positive, you want to test. So all of that stuff can be done with CT scans, and we have tremendous capacity to do CT scans. You can do them in, basically 5 minutes, 5 to 10 minutes. So that has to be done. There are some challenges. We don't have to talk about them right now, but we really need to go all out on the testing. It's just amazing. Italy has been ramping up their testing dramatically, and they're really doing an incredible job of solving the testing problem, which of course they had at the beginning too. So testing is another leg. The next leg is masks. Masks stop transmission. All of a sudden, everyone woke up to this a week ago or so. The head of the Chinese response was asked in this science interview, what is the biggest mistake we're making in the West? And he said, masks. You have to wear masks. And if you look at countries that wore masks, the transmission is much lower. And people go to this logic and they say, hey, you only reduce transmission, susceptibility by 40%, 60% effective. Well, remember, if you have a multiplier and you reduce that multiplier by 60%, multiply it out and figure out how much trouble you're in. A lot less. So it's really powerful to use masks, and people are still not wearing masks regularly. I was just out today, and I drove by some people chatting on a lawn without masks. So masks is another piece of the response effort. Let me just make sure that I'm getting all of them. There's a piece, if you go to the endcoronavirus.org website, and you just scroll down, there's this piece called How to Win. And right next to it is this piece called 5 weeks and why 5 weeks. So you can look at all that. So let me go through the last few of this. One of them, that essential services should be safe. We're probably doing that more or less okay. So people have arranged, delivery from supermarkets and drugstores. People are arranging curbside pickup. Those are the kinds of things that we need. There's a supermarket or whatever, a grocery near where I live that has standardized packages, which is a great way to make efficient making these services safe. We talked about testing. The last two are health related. So health guidelines basically means you really should worry about health first before you worry about disease, which means people need to be taking action so that they don't transition from mild to severe. Remember, 80% of cases are mild, 20% are severe. It means that there are some parameters, right, going back to relevant parameters, that can control whether you end up with that severe case. So some of the things that we know about are drinking a lot, right, and eating well and getting good sleep. And one of the things that many people don't know is if you get low fever, like 101, you shouldn't use medication because the fever is part of the immune response. It's helping your body fight the disease. Don't medicate until you're over like 100, 103. And then go for it because it can be dangerous to be higher temperature. So there are a bunch of things. One of the things that I think is a good idea is not to breathe in your own viral particles. So if you're breathing out and you're infecting other people, you can breathe it back in and make multiple infections in your lungs. So why do that? So try to breathe fresh air, a lot of fresh air, and then try to, when you breathe out, breathe in a different direction or use a HEPA filter or something so that you don't breathe your viral particles. A good idea. I don't know how effective it is because we haven't done any experiments. We could, hopefully we'll do those experiments. But in the meantime, it's surely not a bad idea to try. And the last one is the medical response. And that seems to be how everyone starts thinking about this outbreak to begin with, because they say, hey, it's not so bad until the hospitals get overloaded, right? That was the statement by the governor today. Hey, this is the surge. Excuse me, what about all the people who have died until now? What about all the suffering that's going on? And yes, the medical system is important if it gets overwhelmed because the death rate goes even higher, but surely we don't want the death rate altogether. So, but in any case, the medical response is being overwhelmed. We don't have masks, we don't have PPEs, we don't have ventilators. If you come to endcoronavirus.org, there's all of these efforts to deal with the response. There's trying to get the PPEs to people. on the supply chain. There's trying to build new ventilators. So there's all kinds of engineering going on. There's trying to validate them or get approval for them so that they can actually be used rather than just be on the design board. And that's what gets down to this, fast, right? We have to do hyper, whatever I use the word, hyper agile, because what we need to do, and maybe that's a term already, apologies if it's already being used, but the point is that we have to move fast. But the reason we have to move fast is because we didn't act faster. We didn't act before it came here and stop it. And everybody that didn't act before, the reason that they said they didn't act before is because it'll cost too much. Hey, the economy is going to suffer. We shouldn't stop flights from China because the airlines are going to go bankrupt. Yeah. So those same people are now saying, let's open up the economy. The economy is not doing well, so we have to open up the economy. And the answer is, the only variable that matters is the number of cases. And if we stop the outbreak, the economy will go back to normal fast. The sooner we stop it, the better. If we stopped it to come here, we'll bail out the airlines. But that would be it. Much lower cost. So we are in a situation where acting early, acting strong, going all out is what matters. It's a societal problem. Ultimately, in this case, it's not an engineering problem, it's a decision problem. There will be engineering things that need to be solved, many of them due to the stresses of the fact that we didn't get it right in terms of the societal response. And we have to go all out in everything that we do. But the main thing is to galvanize the community, to galvanize everyone to say, we've got to do this right, we've got to do it soon, we've got to do it now in order to stop this outbreak. Thank you, and I'm very happy to take all the questions you have.
Thanks a lot. We have a lot of questions. We have one.
I don't know if I see them. Can you read them to me?
Yeah, no, I'm going to read them to you. With only 20% of cases being severe, why is it that 40% of the closed cases ended in death?
Because we are not tracking the mild and moderate cases in the United States. We're sending them home. We're not even testing them. We don't have enough tests. So the positive test rate in the United States is at 20%. That's terrible. That means that we're only, basically in New York, they've actually declared by policy they're only going to test people going into the hospital. So we're way behind in testing. So there are a lot more cases that we're not reporting that are symptomatic. And we're simply not putting them on the books. Does that answer your question? By the way, the positive test rate now in Italy is down to 8%. The positive test rate in the UK is like 40%. The positive test rate in South Korea, they were doing this drive-by testing, rapid testing, was down during the outbreak. There it was down at 4%. Next question.
Yes, the next question is your message so clearly presented, thank you, being heard by the people who have sociopolitical influence, e.g. Juliet Kayyem at NKS, Senator Markley, Governor Baker, Governor Cuomo, Senator Schumer, etc.?
The answer is not enough, otherwise we wouldn't be here. It's not that we don't have any influence, but this is what, I've been talking with people. We have some, Congressman Kennedy, who happens to be my congressman, is someone that I know for years, and they respect our policy recommendations, again, not just on this topic. So it was fairly easy for me to pick up the phone and talk to them. And I do think that they're taking what we say seriously. And we also have had some influence nationally, i.e. even at the federal level, but not clearly as much as we would like to have. And similar at the state, we're able to get some things into the halls of power, so to speak, but it's far from enough, very far from enough.
Another question we have coming in is modeling tools in Washington State. Daily results coming out from there seem erratic to them. What is your assessment, given they've been used for decision making?
You mean IHME? Is that what you're talking about?
It does not say. It just says that the modeling tools in Washington State.
Okay. So their model is based upon assuming that the outbreak will follow the Chinese trajectory. Stop, full stop. So basically, as soon as you apply a lockdown, you're going to go through the Chinese trajectory. That's crazy, because as I just explained, all lockdowns are not created equal. Here's the thing that seems to be happening. The policymakers are turning to scientists, particularly epidemiologists, to tell them what to expect. What is the future? Look in this crystal ball and tell me what will happen. Predict it for me. And the reason why they want the predictions is so that they'll know how many ventilators to prepare for, or how much, floor space they need to devote to this, right? And they're just not aware that the relevant variable is not time, it's action. That what they do actually controls. So the person who said this actually very nicely, and I'm sure that this is one of the reasons why California is doing better than Massachusetts, is that the governor stood up in California when they did the lockdown in California, and their lockdown was the first in the country. And he stood up and said, you can look at his speech, he said, it is not, I don't remember the exact words, but he said, it is our choice what happens. And that message has not been propagated well enough. So we have the modelers at the Imperial College, and the modelers out of Harvard, and the modelers out of, so on. Everyone is trying to tell us what we can and cannot do, because they have these models with all their assumptions in it. And I just don't think, I think the challenge is the opposite. The challenge is to empower people that they can do. And by empowering people to know that they can do something, to inform their decisions, rather than tying their hands by saying this is what will happen, which is wrong.
We have one question, which is, in your opinion, are today's proposals by the US government sufficient to knock down the virus?
And the answer is no. There are, so it might lead to a decline, but it's going to be a really slow decline. And why would we want to do that to ourselves? So the key pieces that are not being done are, number one, isolation. We're sending people home to their families, and it's crazy to do so. And it's not just that I know that from from a scientific perspective. I know that because I'm being told this of people that are going home and infecting their families. It's all over. And they're even sending people that are sick home to nursing homes. How can you do that? Right? Vulnerable people in institutions, you're going to send someone who's been diagnosed as positive back to a facility where there's 100% certainty that it's going to propagate through the facility. Talk about crazy. So this stuff is just going on every single day right now. So isolation has got to be up there in terms of what we're not doing. The next thing that we're not doing is the testing piece. And again, CAT scans is what was used in China. It could solve a lot of the problems. We need to get that into the mix. But we also need to ramp up the other testing. We just need to do testing. And this is an engineering problem. We tried very early on to bring institutions in order to help because they have capacity. And, everything gets bogged down in paperwork and bureaucracy. And there are ways to solve problems. And honestly, even I thought that we would be past this problem by now. And I thought that even the regular system would be able to solve this problem by now, much less sort of rapid action efforts. So testing is number two. Masks now been advocated for. It just needs to be pushed home. We need to make sure we're doing it for everybody in public spaces. And there's one more that I need to remember what it is. We went through it and I'm just not remembering right now. So isolation, wear masks, the travel restrictions, the first one, right? Everybody still thinks the travel restrictions are kind of not a thing. And they're the most thing. They're the best thing. And the way to do travel restrictions is basically to say, we need to grid the space into natural areas, states. Sometimes the boundaries are not right at the state boundaries. So somewhere else, you create the boundaries and you only let across those boundaries essential transportation with the right kinds of checks, temperature checks, and protocols for people to go in and to go out. But why? Even though it's all over the place, why? And the reason is because it's still not everywhere the same. And if you can suppress it in the place where it's less and get free of it earlier, it's a huge win. And people are now talking about opening up the economy. Well, the way to open up the economy is to have places that are not infected, not have the disease, and start opening up. Where would you do that? Well, there are parts of northern New England that are clearly doing much better. There's North Dakota, right? There are places where there's less disease, but if you're going to open it up, you can't open it up unless you prevent people from bringing the disease in. So this is the tail end of the process, where it's clear that you need to have travel restrictions in order to move past the disease in any kind of way. What are you going to do? Wait until the whole country is free of the disease and then all of a sudden lift off the regulations? That's crazy. So instead you impose travel restrictions and you raise them geographically using a protocol that makes sure hey, there's going to be a second wave. All of have it and restarted progressively in different areas. That's really the right as long as we are where thing is pushing home the mask.
This next question somewhat follows upon the other, focusing more on extent. Do you believe that we here in the U.S. should be implementing the same policies as in China with contact tracing and mandating everyone to wear masks if going out and policing that in order to fight against the virus?
The extent to which one has to police something is the extent to which there's buy-in. So the first thing that you really want to do is to have the right kind of, if people stand up and say, and this is not surprising, right? This is always the case. Someone has to stand up and say, we're in this together. This is an all-in thing. We're doing everything that happened. Every case that's happened is because of what we're doing. I think even Governor Baker has said that. Unfortunately, he also causing what's happening. Then people will take action. And people in Massachusetts, I thought, were taking action, but again, people are. So, there's this problem. One by one. Number one, you have to decide how much you want to do enforcement. If there are only a few people that are doing bad things, they're the people who would break laws, break laws. So sometimes enforcement is appropriate. It's not a new thing that when you have a society at risk,